Anyone please call the operator?
Do you hear that? That's the sound of a community. That's the sound of wellness. That's what modern urban healthcare looks like. This is CHASS, Detroit. On the southwest side of Detroit, the Community Health and Social Services Center has been serving Detroit's underinsured and uninsured for more than 40 years. What began as an infant and child clinic has blossomed into a comprehensive, affordable medical home and wellness center for thousands. From the Southwest Center on 4th Street to the thriving Midtown location, CHASS will see more than 14,000 patients this year.
CHASS are extremely unique in the sense that we're able to provide a complete set of services for the family. So everything from transportation to get here, the prenatal care for the moms, the pediatric care for the kids, dental and pharmacy, nutrition, a lot of different services that help people be as healthy as they can.
It's not just about medical treatment in the traditional sense. It's about social support and education and interacting in a much more comprehensive way around healthcare.
Not only diabetes do they help me with, but even through depression I've gone through. When my mother passed away, everyone was tremendously helpful. It actually kind of makes me emotional, thinking how really they do care about us.
You know, 2 generations of my family have come here and continue to benefit from here, especially a lot of us women that, you know, need health care. We feel comfortable coming to CHASS Clinic, and I still hear so many Southwest Detroit families tell me the same story that I tell people about CHASS.
With a focus on primary health and dental care, behavioral health and other wellness programs like nutrition counseling and community-based research, CHASS is a model for the delivery of urban health care. CHASS has been an anchor in Detroit for 40 years. In response to the closing of several community hospitals in Southwest Detroit, Hispanic leaders along with local and state public health officials collaborated to open CHASS on West Verner Highway in 1970. They set out to make sure Detroit's under and uninsured were able to access affordable primary health care.
So we brought people together, asked those hard questions, and we were fortunate enough to have it fall on not deaf ears, but people who wanted to do something. It was really started as a community effort.
There used to be a blue room, and I keep asking folks at CHASS, where's the blue room? Because when we got to the blue room, it meant we were getting close for our shots. So that's one of the memories I have about CHASS Clinic.
And I remember getting there, being in pain and waiting forever. And then eventually a doctor would see me, I'd get better, and I'd be happy again. So.
CHASS is a pillar of the community. It's the center of health for the Southwest Detroit community, and has started to increase that same status in the Midtown community where we have our other site.
With the clear and growing need, CHASS opened its Midtown location at 7436 Woodward Avenue in 2001. And the comprehensive wellness programs that served the Southwest community for over 30 years would now come across town. CHASS is unique in so many ways, but its comprehensive programs, holistic wellness approach, multicultural services, and partnership with Henry Ford Health System make it more than just a clinic.
The partnership between CHASS and Henry Ford, I think, is probably unique nationally. To have physicians from an integrated health delivery system such as Henry Ford actually being the practicing physicians at a federally qualified health center is an unusual relationship, and CHASS has served as a model for that for the entire country.
CHASS starts with world-class healthcare programs and tailors it to the cultural nuances of Detroit's communities. The result is a remarkably effective and nationally recognized model for urban healthcare.
Yeah, I believe the staff they really care about you when you come in here. They pay attention to you. The doctor is really unbelievable. The best doctor I ever worked with.
When I feel so bad, I can go at the Henry Ford hospital, and I feel that Henry Ford Hospital is the best clinic for me.
You know, this is a very busy place. It doesn't have a lot of opportunity for time, but they make it.
It's a community-based organization. They're actually part of the neighborhood, and so I just think people consider this place like family.
So the need for a primary care presence to limit disease, treat it early, is really important for actual survival of people in the community.
And then we have two ancillary projects, the La Vida project, which is a domestic violence project, and the REACH project, which is racial and ethnic approaches to community health, which provides diabetic support for the patients in between their visits to see their primary care provider.
That's the importance of it, is that we're able to take care of the whole person, to create not only a healthcare system, a primary healthcare system, but also create a one-stop shop for all services.
These programs are more important now than ever. Upwards of 50% of Detroit residents are uninsured or underinsured, and without insurance, many go to the emergency room for routine care. CHASS alleviates some of the burden on local emergency rooms by serving as a medical home to thousands. As the need for affordable medical care grows, so will CHASS. With a 3-month wait to enroll for some services, CHASS and its programs are in constant demand. And in response, CHASS has embarked on a mission to build a new 48,000 square foot facility at the Southwest Center.
Just in general, I'm excited that we're going to be able to see more patients. We'll have more providers. We'll be able to provide more services like the ones that I talked about. And you can just feel the excitement in the center. The employees, we've been talking about this for a number of years now, and even the patients, now that they know that we're going to have a new center and have new things going on, they're very excited to see this new state-of-the-art facility we're putting together.
I think an expansion is well overdue, and I'm excited about it because I think it's going to be even more of a special place than it is now.
As CHASS prepares for the next 40 years, it's never been more important to ensure access to quality primary care and wellness.
So CHASS has been my life. It has been mine, my sisters, my nephews. 3 words: my second home.
This is the fabric of our community. This is CHASS, Detroit.